On today's show, we'll be talking about preterm babies and how to care for them. In Kwala no time and a woman and how to take care of them when you from. We'll meet young Jeffrey in Ashanti Region with a rare medical condition. Dr. KK has a heartwarming story for us on This Week in Medicine. So I'll tell you about the hidden benefits of ginger in jewels in our kitchen. This show is brought to you by Vodafone. Further together.
Now you can be part of the extraordinary world of endless possibilities on Vodafone. With the best value and amazing data offers and services available in Ghana, your dreams are achievable. Get more for less with Vodafone data. Vodafone, further together.
Welcome back. It's always a pleasure to see you and Ava.
Yes, dear.
You see me shoe near your wedding shoe. According to Asimis, my year one.
Oh,
yes, I come
the shoe is very nice. I don't know if you can see your favorite host shoe. It's a white shoe with diamonds. I think this is what she wore on her wedding or engagement.
Diamonds are a girl's best friend. And talking about girls, today's myth is all about women and what men think we should be exhibiting as virgins. Well, ladies first, and I'm a
exsanguination.
I think I see a lot of cruelty in the Mythbuster.
Tell me about it.
The guy is sweating too much.
How?
2, the blood is dripping.
How?
3, virgin breaker. I mean, for lack of a better word. I mean, Charlie, I see a lot of cruelty. Exsanguination is, you're not saying it well. This one, you're hitting the girl.
Okay.
If you see this amount of blood dripping on the floor, you're hitting the girl.
Oh.
Indeed, we may see some bleeding. Sometimes. When you see it, it may be some. Sometimes it may just be on the shaft of the penis.
Oh,
yes, it's just on the shaft of the penis. So if you happen to clean the penis, then you may see that there's some blood on it.
Okay.
Sometimes you may see it on the sheets like people expect. Sometimes you won't see anything. So you don't have to bleed for you to be a confirmed virgin. And I'm sure Abba can throw some light as to the physiology and the anatomy of the hymen that makes, you know.
Oh, but I mean, I think the point I want to make is that you can't use the evidence of bleeding post-coitus to say that this person is a virgin or not.
Post-coitus. This is a professor. You see, I'm not wearing my white coat today, so the professor has herself has taken a position.
No,
post-coitus.
On your day, it's true. Because you see, the vagina is structured in a way. God made it such that when a person has not had a sexual intercourse before, there's a thin membrane.
Tear rubber. brand new tear rubber.
Wait. Okay, tear rubber. What's that? Can't be any tear rubber.
There be when you home use. Brand new. From home. Tear rubber.
Tear rubber be what a thick. You be so see a thin.
Oh.
Sister so say thin membrane. Tear rubber.
And the concept.
The concept. Thank you for saving me on this one. You know, good one. The concept.
No, but anyway, there's that thin membrane there that God put there with a small hole in between or within it.
Yeah.
And usually during the first sexual encounter, this membrane is torn, is opened up. Okay, and that might cause a little bit of bleeding. I'd like to emphasize on what Kay said earlier. It's not really like moja betuni pana yesenia. There's a little bit of blood stain, maybe a little bit on the sheets, but usually on the shaft, like you said, and that's it. And sometimes you may not see it, and for several reasons.
Why?
If a girl has been in athletics or has had some kind of trauma.
Athletics,
Oh yeah, sports.
Sports.
Unless it's literally in sports.
Only sports.
I know that, no, but when you say sports, be no, yeah, sports. Or active for school, not just simple, active sports girl.
Because it's a very delicate membrane and it can easily be broken. In TM Fenum yardsticks when bleeding into when you're veg.
Apart from sports,
Apart from sports.
Yes, what else?
Trauma.
Like what?
If you fall astride. Or like you fall astride or anything that.
Oh yeah, splitting.
No, haven't you heard that statement before? Seriously?
No.
Enter a trouser.
No.
Oh. I thought you were doing this since. What bad trust? Yeah, what's the one? No,
everyone is splitting.
About trust. International school. What's bad trust? You're talking about bad trust.
So I also to me consider that problem.
Yes, it can. And you know, for athletic girls, you know, at that age, when they are dancing and all that, it's very
a lot
likely.
of splitting happens.
And
you know,
she
ballet
may even,
dancers and all that.
She may not even realize that she's bleeding or she bled or she may never recollect the time.
Because if you're not supposed.
Exactly. And you may just see a stain.
Yes.
You know, then it passes by.
Oh wow.
And for me, I think that the onus lies on and that's when you go for style. So that's something release. The onus. Yes, thank you very much. Actually, it lies on the man to make sure that the period or the process of breaking the virginity is not traumatic. It's very important. You know, not too long ago, I met a lady. She's been married for 3 years.
Okay.
A good girl, married as a virgin to a virgin.
Oh.
And you know, a lot of things have gone on. Just to try.
Sexually.
Yes, between them.
Okay.
Not out of malice. Not sure that but for the woman to be able to, for the hymen to break and them to enjoy the intimacy of their marriage, they've struggled. It took them about 4 months.
Wow.
Yes. Eventually, how it had to be broken. No, I mean, so there's a lot of psychology, you know, and all of that, because you know you have to open up.
Okay.
If you're apprehensive for several reasons,
you're feeling,
you know,
a little bit too shy,
a little tense, shy, afraid.
Ungody chocolate.
But
we said that in the last episode.
You know, so I mean, so yes, so I think that's something. The onus lies on the man to make sure that you create the environment. I mean, you both will attest that when the environment is created, you know, the woman will jump on it.
And we'll get some.
Thank you very much.
Get some with them for the next 12 or 30 weeks.
So if you're a man and you are happy that they are calling you virgin breaker, I think it's rather unfortunate, you know, to have that.
Virgin breaker and just say, "When I'll be my
yes,
all right.
You know, there's this them use the word machoism. Machoism.
Right.
That's, you know, amongst the boys community, you know, hey, she was crying, and I don't think it adds anything, honestly. If you have intercourse with your partner and your partner is crying, you've got zero. Please.
And yet tears of joy.
Please. Hey, there's tears of joy. That one too is there. Now that you've mentioned
I
tears,
we are not talking about
you know, sometimes too, if you do a very, very, very good job, you see the tears of joy in Jesus' name. Amen.
I mean, I'm sorry.
You.
That one too is there.
I'll tell your wife.
That one, oh my wife. My wife is a good boy, you know. Don't go and tell her.
No challenge. Well, talking about tears, I don't think that little Jeffrey, he's barely 2 years old, would be crying tears of joy yet, because he has a kidney problem. It has caused his stomach to be distended, and it's affecting his growth, his innocence, his joy, and his social life. You think 2-year-olds don't have a social life? They do. And when they can't go anywhere they want to and do what they want to, they can't grow well, and they lose their smile.
Jeffrey me kids ade. Me bane Jeff. Jeff wedi afe ene bosom nson. Ebra me nyem Jeff no. Me nya 6 months a me call antenatal na doctor ka kire me say Jeff kidney no problem wo ho. Nti yesese ye transfer ye ba konfa noche. Ti doctor ye say nya me boa me wo a kebeye no operation. Nso me wo ye no anche na yare na ebaye. Me wo no foforo na de. Na wo mu se na eson bet na ne yefuru ne nso bia sa. Nti mra no na wo nyini kakra ni nyina na nsesa ye ba. Sese ya na eye kese.
I'm Dr. Michael Amwa. I'm the head of the pediatric surgery unit of the Korle-Bu Teaching Hospital. He was born with a problem with one of the kidneys. And basically what he has was that one of the tubes or the pipes that drains urine from the kidneys, which in medicine we call the ureter, is blocked. And because of that, urine produced from that kidney cannot drain into the bladder. So basically what has happened is that all the urine produced by that kidney since he was born got stagnated within that kidney, and as time goes on, the kidney became enlarged to the extent that now the kidney is basically damaged.
He said, Doctor, she said, any kidney na just so much dear. I say, ni if you honomo na oyusu dear no. But the chebe bra, a bema na koka dear no. Ama no so be an esan de how for Abba.
Ideally, the surgery should have been done some months back, but after we did our assessment, there was the need to conduct further investigations, and some of the investigations were a bit costly.
And I'm scassam crazy, no more kind, no. Me, you must shame my fan. No class, it's answer me nearly that should be a say be cry. You could be a bomb boy saying na Messi be a quite better me fast away to ya and cry for friends who fear. Oh, you know, beyond, sir. And so Jeff from Kwana, baby to ma. What is sir? If you say I ran and so buy a cry, ne papa cry so. A juma semo and quay. Tis a sea, the no man as a ya jeans and moon cry. And run a Jeff for Bowan kakra near Dean. Until I no pay necessary, Miss Sandana Baname than a bachelor doctor. The doctor said the situation is a Becca Hannah. Now, my dream, women, and Tinaka, Messan Catcher and so, Mammy, coffee beam. In Coboa, home ran and doctor said, baby, said the econo, and your man could ye ma above Frananti.
Yes, the surgery has to be done. Even after taking the decision, getting money to fund for the surgery was also a bit of a challenge.
And I'm discussing the year being in our cry, and I'm a medium cry sign. Ashim.
Luckily, I got hint of Vodafone Healthline looking for people to sponsor. So someone linked me to one of the coordinators, and then I put in a request or an application for him, and God being so good, he was considered and was taken on board. I want to thank Vodafone Healthline for coming to the aid of this young chap.
Dem work at Vodafone for the baby. We didn't make that woman say.
I used to think Abba and Keiki say, when you see stomach distension, then maybe it has something to do with the liver. I honestly didn't know that a kidney problem can cause that. What is happening here?
Okay, so the kidney is responsible for filtering waste out of the body. And in doing that, it excretes salts and all kinds of minerals and water. Now, with this young man, it looks like it said that he had some kind of obstruction to the exiting of urine from the kidney.
Okay.
In children this age, the commonest will probably be posterior urethral valves, meaning that there are some structures that block the urethra, which is the part of the urine tract that is inside the penis. Okay. And because that part is linked all the way through other structures to the kidney, when this obstruction persists for a while, the urine backs up and causes swelling up of all the structures thereafter. So the bladder and then the ureters, which join up to the kidney.
Yeah.
And the kidneys become big.
Okay.
And then they get damaged. And when they are damaged, they're not able to do their function, which is to filter out fluid. So fluid gets retained, and then they can sit in all areas, including the tummy, including the feet, including the chest. So there's evidence of fluid retention because of all that backing up, which I think is what unfortunately had happened.
If you see his stomach, you see his abdomen. I mean, technically his abdomen, the whole area. It's all big. So like you have a water hose, okay, and you are producing this much of urine, coming to about 1,007 in the adult, per day or so. Every time you are producing the amount of urine, and every day it's not coming out. Let's say if even it's both kidneys, so maybe 1,000, maybe offending 1,007 divided by 2.
That's
Mass.
8.5.
Good, about 850 from one side. We're talking about an adult now. They wear a mass. So you see, it all backs up. So then the water hose that is bringing the urine has become so big. Now this is not how it's supposed to be. Under normal circumstance in this child, the ureters, the kidney tract, this finger is big, bigger than that. It's really small, really thin in God's own. Now it's become so big to occupy all that space. Like Abba said, when it backs up, it's going to shut down the kidney. Because when the kidney is working, it can't. So the other functions, like the kidney, like producing, helping with your blood level, excreting, all will go down. Now, good. Now the stomach itself, not your abdomen, the stomach itself is in the abdomen. Now, if you know where the kidneys are from, if assuming he has a right-sided disease, then it's going to be coming from the back here, somewhere here, where his kidneys are. And it's filled up the whole place. So that means that he's now going to compress on the stomach. I'm sure you all know how you feel when you're pregnant. You don't eat well, okay? So you realize that, exactly, that fullness you have is what he's having every time. You see, in addition to this, the space effect, also, Hadin doesn't close well because there's no real, so it's going to have reflux, it's going to have problems with heartburns, so many things. I think that a timely intervention is needed, and I wish it was done earlier. But I could presume that the main constraints have been funds,
and we are grateful to
Vodafone.
Yeah, grateful to Vodafone, because honestly, without it, I don't know. It's like living in hell. Jeffrey, it's going to be all right. I'm very, very sure of that. We'll be right back.
So that mom can be able to open the door. This is it.
Place it on the door.
Here's my little brother doing something special. He's setting the camera up with another bright idea.
Let's just open the door.
Yay!
Mom, I got this.
Afedie, usu betumi anya kwanya sronko a ye nije ye power Vodafone so. Ye di data bundles a eni seso Ghana ha brel. Ye ma oda ye so, ni eni daso nyina bem. Enti beka ye ho, nya data mo eni je power bebre.
Vodafone, further together.
Teteno, se wa kwala na se wonyi nwie wo yefuma nso opia. Na ye nsem pi. Ye obia na nim so be handle ntina kwala ne tawu. Bananse doctor fo nya nyoma bebre a omoye matise bebi e fa ne nikura ne kra ne de. Mema ne wore doctor bi wo ho be kyen ase doctor for so soon incubator no nyoma bibi but enne de beka ho asem no me ye sure safe ye nananom botom adenti na make asa Kangaroo mother care omo se ne bo fofofo utumi o baby a hey awan wasem Dr. Beatrice Nyann obetre ya sie wo ho na wa menko baby a doc welcome.
Thank you very much, Frima, and greetings to our cherished viewers. Thanks for the opportunity. It's great to be here.
It's a pleasure. It's a pleasure.
Good,
Na adia en cost is kadi. Me many di
the
ho.
idea cheap there. Low cost but effective. And this will be a money panel.
No correct.
It's very good.
Inti Kangaroo mother care. What's that? Tete no say na me kan beginning. The wa kwala no nyi nwe ya na trouble bebre. Na Kangaroo mother care na den. Is it just meant for kwala on when nyi nwe wo yafumu ana?
Inti typically Kangaroo mother care is meant for kwala. What's say full term, yeah, the BBB the full term.
Okay.
Just say we do 9 months echo.
Okay.
Yen wo your customer can say 37 completed weeks. 37 completed weeks.
Okay.
But the lay person because say 9 months.
Okay.
Into a crowd before 9 months no. Usually almost as saying almost term counterparts no. And a lot of the times no so body organs no informing we papa for want of a better word.
Okay.
Into I say be because prepare ba.
Open
So they have come, they want to enjoy life. So they've come ba earlier than usual and say
okay.
You have to really handle them with care.
Okay.
They have a number of issues that we have to deal with. Send make
okay.
To me I wo kakra to me. Send me wo anasa babies almost so no. Say whether any cold kakra to me body na kasa be yem omo ho ayeshi kakra no to me because omo fat be the brown fat skin ni mo no omo nhye dan ni bebre sa intention na what you omo intina preterm babies are kept in incubators.
Incubator na body
you know you're high tech.
And then the
breeding very expensive. Very expensive. About 40 chenoma bebre but for them to part with an incubator it's a lot of work. It's
a box, Anna.
It is like a box, transparent. You can see it and act immediately. Exactly. Number one, incubator. Keep you warm at the right temperature. And because there's a barrier there, so so one, your temperature regulation. Because almost in China, what do you know?
Okay.
It's incubator.
Okay.
But Kangaroo mother care no, in our low resource settings, a bebwayan pa because a lot of places are yeshua cranketing kit only incubators. As I said,
Into incubator now you're ding.
We incubator now.
Kangaroo mother care
exactly. And na Kangaroo mother care na besha. It actually started in Colombia. 1970s anymore. Because I check.
And you see me.
Yeah, when you see any.
Hey, dog.
Who's then calling you pa?
Okay.
So this technique came in, and our boy in Bebre, especially in our part of the world.
Technique, no, one no fahon kakra. An incubator, no so actually incubator name ma a one diom. Kangaroo mother care no so it me yes I na.
It's a Kangaroo mother. Kisi and cry person a giant mother na shame fin.
Okay.
We want to say Kangaroo care.
Okay.
Because father bet me.
Hey.
Once there will be our chest now, but to make demonstrate here,
okay.
In the exam, brain as well. Into Kangaroo care. It will benefits baby. Benefit baby. It is like a skin to skin care of the premature baby.
Skin to skin, just
skin to skin. Usually, Rebecca says, "She blouse I to me be a name."
Okay.
Then baby.
In jacket and queen.
Come in beer. Come
my skin to skin.
Skin to skin. Who's saying I cried? You almost shame. You better take you in.
I say in animal.
I say in, but say in any loose cack. And in a go baby.
And your fashion baby.
Or dear home crying. And your fashion one. To skin to skin. Baby's near skin, almost near naked, but we born a diaper.
Okay.
And then the baby will have a cap on.
Obesheche.
Because almost and check no more cold. Lose a lot of fluid from tissue any almost skin in general. It's a baby in the chest, a tarry mother, and that's a father, and that's be your baby our chest. Near the tama. A keeping it secure. Abu say. It's a match send a year. Now I shall watari lose via eguso. And then you can go about doing your normal chores and whatever you want to do.
To me the nepra.
To me the yen your person we be. Once a yen get that room kolan we chi. It's an our case yen ananum. Just that we have transferred it to our front. And then also once and then skin to skin. But he say skin to skin ye we need. So it's something we have just transported in front of us.
Niku ni ye den. And no see a kangaroo mother care nyoma ni bia na say incubator nyoma na e din keke.
Inti niku a abbreviation be NICU, which is a neonatal intensive care unit. It's a baby a ye din kola ya wo omo fresher, omo problems, critical problems. Eko. Inti baby bi a ya wo no or problem. Ye de call baby ye frɛ ho neonatal intensive care unit. Inti ano ani niku no.
Inti kangaroo mother care no mutumi ye wo niku ana.
Good. Inti kangaroo mother care no ye wo niku. Niku ni bi wo ha ye wo incubators no. You start off from the incubators.
Okay.
But they do baby a omo much stable. Omo ba sa ne kolan bi omo yare pa o.
Okay.
I so omo mupo by heart. Ye go yensa ye share gloves e ti be hu ye wo niku ha.
Operation.
Good. As I was dressing for operation. And then cry me feminiku. Na me rest kaka na maba he.
Hey.
Inti omo ye stable la. Omo ye stable ya sha se mo omo aduane ni ade a. Ni ya sha se ye kangaroo mother care. Inti wo niku ni mom. It's wo ba ye be you ba na fi incubator no. Then we put the baby skin to your chest. We cover the baby up with a cloth and then you can cover yourself up as well. Open a. In that position, you can easily breastfeed. Breast typically you pay breast milk. Because almost more problem be problems be or woman formula a bit to me triggers our problem. Especially almost less than 28 weeks. Just say be 6 months. Oh, I've been in Bantam. Since in the very, very well-resourced countries, people are 26, 24 are surviving.
Oh wow!
In terms to me, Bantam, baby, we are 600 grams are surviving.
Only 1 kilo.
That be like 1 kilo. They see 1 kilo crowd. We are happy because we are good to go. Into 600, 800 grams, we have those babies. Into we just release the cloth a bit. Near position baby in this we call the football position. So now you cry football, say it is very easy. That baby ne sake from the same side.
Inti ano sa no akwala ni tini she ha.
Inti akwala ni tini we nim say. Ina ne buttocks no e she wo elbow ni say.
Akwala ni ti wo unsa say. No wa ni tini mu say.
So ni tini na kwa chire
kakra. Ne tukete no she ha.
E she ha. Na wo ni phone. So that's one very comfortable position omo kangaroo mother care omo to me numu elufo
now so obia to me bua no papa no be den nufunso no be den dia ma akwala
exactly inti papa mother sleep bi wo ho bia na at the time na say I start kangaroo mother care kangaroo care no onye fine inti I'll just chip it in say mami or yari and say caregiver bi or yaro you should not be doing kangaroo. Once I then skin to skin. It's imagine so or rashes be or say you don't want to be carrying the little baby and be skin to skin with that baby. No. It's mother or you're fine. It's mother sleep be or yari. The father can do it. Even though breast is quite comforting and keeps them warm. We love the father. The father's chest is also fine. Father so to me in that instance yes, you chin in the phone, so you pump in the phone, so
from
mamino, which is called expressed breast milk.
Okay.
And a baby because obi a me bada niku because I intensive care unit one dark so even from the mothers they express the milk from us near the milk na my baby but in the event say we cannot get breast milk sometimes it's unfortunate say be a mamini ni we free we don't want that and I say mamini yare it's
breast milk bank we are organ.
We are it's good Saudi one of these days remember ani account was because another story because we need but the person ya shase because breast milk is the best for the baby. Is the best for the baby.
Answer your demonstration. Regarding breast milk bank ya my mother-in-law was one of those few women, maybe kind of few because she was well endowed a lot of breast milk. But not see baby no we cry. But not the same crocasiemu our kwawu mantem ho no no expressing a breast milk just for relief.
Just for relief.
And the doctors were using it to give to these babies who've lost their mothers. So I actually assumed that it's still in our system. But if it is not, it's a topic for another day.
It's a topic
because
for
I'm
another
sure
day.
some mothers would love
as you
to
can
help.
imagine these days, to me, will be background to me put checking embryo. So you cannot just go and give somebody's breast milk to. You need to screen. Make sure mother doesn't have because some of the diseases can be transferred from the mother to the baby. It's a bedroom, but we are not there yet. Yes.
It's doc. I'm from the able fitness coach here. Now you should never chance any a kangaroo mother can say he has special equipment and I say as cheap as you say.
As I said.
If you are,
thank you.
Welcome, Doc.
Over
to you.
Okay. Good. Hello, mommy. How are you? It's usually before we start it, any mothers na kasa.
Okay.
I prime on what the whole thing is about. And as I go through Senyameka, and I'll be talking about the immense benefits. Senyameka is low cost. All you need, say, you're a nice mother, what has say. And your baby, very healthy baby. Yeah, in the time I'm so I won't. It's Senyameka, your baby nature new, but you assume say or sheche. When it is so. And ye be assume to say on sheche diaper pet near the bone. I am call an almost anti diapers in wear so. But you will try and fold it down and about down say. Send your bear and a coconinia this a daho. Into bones and a coconinia a daho. Into ya catch your mammy dada unim. Or beshe a young mammy when your rashes be on the chest, mammy or yari or bow one who yes she darby and on yes sir. And now obeshe atari a bit to me be a nim. Okay. I'm on the skin no at the ho. Na baby so the skin at the ho near the atari ho. Into your bear as you may say the skin at the ho will be in a blouse no. Into the baby usually baby no I am on sound I am on son was through say. Into your bear cost through say. Near chair baby con abba side. Okay. Good. I'm say kakra beba. The baby moon person in when the crack time my many chest lisa. So we'll put the baby there like that. The arm will usually be like this. Usually the legs are also a bit bent. It's skin to skin. We are tiring you. It's just diaper. We assume it's just a diaper. Then ya chair the con. Woman the con in you say. And so to me home. Woman in cost to baby. Otherwise the airway will be blocked as well. Then we have our cloth. It can be any cloth. Call sheet. But there's no. I know in some hospitals they fashion out some very specific fanciful one. Obi will also on your cause I don't have money for that cloth. No, you can use any cloth that is clean for the baby. So we wrap. It depends on how big the cloth is. So this is quite big, but typically we would go this way. You want to go below the ear of the baby. It's a baby in
katana so.
Exactly. It's one katana so crown or katana. It's just this way. In Sana Senyameka I was true. Yeah, usually one person will help you. Until baby say, "Now work on the cheap." We call a chair. Auntie, so baby no muye mami. Why? Kwenim kakra mami. Nti ye ne sana. Ntu manage kakra. Nti we chichen tight to keep the baby in place on sleeping cord down because in kolani susa. One sheni obesha no cord down. Why kiti pacho kwenim kakra nti. Kwenim kakra mami. Why? Me a chiche. We be the tight but wonye ne senya mami no ntumi home. Eno so nye. Until I am being fashion out on my modern. Is it tight enough? It's tight enough. As you see, my many blouse no be share egu. Adeni achiche so you can't use it jacket be na wa share egu so. Na baby will ho say. Adena kata just below the ear. Na the corn aba say. Then mommy is wearing her jacket over it. It was a jacket. So baby ni tipe na obehu. It's just the head you see above, okay? Then in between the breasts. As I said, another benefit is that babies need you ha. Omo home kakra bedu baby no me jai home. Okay. Omo sa na bi rekisi omo mususu apa no. Nti mama ni breathing emma akola ni so breathing ye regular.
O kopene mame.
Heartbeat me so say ebi wa kwa ye regular. But o ye kangaroo mother care or kangaroo care na. And mom heartbeat me so you're regular. And I can imagine baby or shiny mammy and him say, almost soon baby. Who ya de cry no da. Who da cry betumi ada so now I incline o bed ne kakra pillows too. Nti omo weight gain in term. Enche no my kese.
No my fine.
No my fine. And a mama no so cry ma unya confident you bond with your baby. You bond and you feel like you are really in control of your baby's care. They say baby need that baby, and also that baby. So the mothers also have some emotional satisfaction.
Yeah.
Bonding is good. And then because usually the body is such that so baby ni won't change. I do catch your body breast milk. Say produce the milk. It's mothers are babies, baby, almost one that baby. I want to produce a lot of milk. But you can imagine, say, baby, your kangaroo mother, your breast milk will just flow. Wow. Baby will eat and be happy. The other thing, so yeah, babies in kitty, they reflux, they do almost fake. Half but who keep you up in the kangaroo mother care position? So vomiting is reduced, reflux is reduced, and all in all, almost health and you're very good. Okay. Normal weight gain, so you're very rapid and optimal, like what we want. Okay. It's benefits need their dorsal. Benefits need dorsal baby. As I said, who person will feed in as well. We just release it a bit. Now where you up down, so we sometimes release it a bit from the back. Good. Now the baby number. A lot of mothers almost prefer football position. Otherwise, you can also do the cradle position. In turn, they obey you. We say good. You are doing very well. And say, we are tossed saying. In say, yeah, we don't send. Then your thumb will be just below the jaw. Now on sabakun or buttocks so. And then if you want to do the cradle one, and they're left to left, left to left, right to right. Who pass all your food? Who pass all your football and they're straight to say. So then when you hold the baby like this, and then you see the way our football on it. Now I can say, now I'm on a new phone. Good. So that is very easy. All in the kangaroo mother care position. If you want to take a nap too, you can lie like this and let baby breathe on your chest. And then you do it.
Dr. Nyann, yeah, that's say. Hey, demonstration there. My sister or my Thank you so much. We've learned so much. Thank you for coming. Thank you for showing us. Indeed, into my pen here. Into my pen. Low cost. Low cost. Make us say if you're not able to Musafi Matias here. Into my pen. Matias here. This will benefit our babies. They will grow well. We'll be right back.
So that mom can be able to open the door.
This is it.
Place it on the door.
Here's my little brother doing something special. He's setting the camera up with another bright idea.
Let's just open the door.
Yay!
Mom, I got this.
Now you can be part of the extraordinary world of endless possibilities on Vodafone. With the best value and amazing data offers and services available in Ghana, your dreams are achievable. Get more for less with Vodafone data. Vodafone, further together.
With the help of Vodafone Healthline, we've been able to secure funding for baby Jeffrey's surgery. Let's go have a look.
Today we are talking about a 1 year, 7-month-old boy called Jeffrey. Jeffrey was born with a condition whereby one of the tubes that drains urine from his right kidney was blocked, and unfortunately the parent did not report early. So at the time that he was brought, what has happened was that all the urine produced from that kidney has stagnated and has caused the kidney to become balloon or swollen, filled with urine. And as the pressure builds up on the kidney, what resulted was that the kidney has become damaged or destroyed such that it is no longer functioning. So so today what we are going to do is that we are going to take out that non-functioning kidney, a procedure which is medically known as nephrectomy. That is taking out the kidney. That is what we are going to do for him. So we've successfully finished with the surgery. It was a bit difficult because the investigations we did were a bit deceptive. We did not see the actual report that the investigation gave, and so we had to change the plans that we intended to do. Initially, we had wanted to take the kidney out because we were made to understand the kidney was not functioning. But when we went in, we realized that he had just one kidney, which was diseased, and so we have to do everything to salvage that kidney. So instead of the nephrectomy or taking out the kidney, we did a repair of the blockage that he was born with, and so now we've established a continuity. So now urine can flow from the kidney into the bladder for him to urinate. With what we've done, we expect that maximum by 2 weeks the wound will be healed, but we've put in a catheter and then a stent in the ureter, and that may take a bit longer to be taken out. The catheter, within 2 weeks, maximum 3 weeks, we can take it out. With regards to the stent, it will take about 6 weeks because we will have to do another investigation to be sure that the continuity that we've established, there is no leakage at any point of the repair that we've done before we can take out the stent.
Baby Jeffrey has undergone his surgery and it was a success. We thank God for that, and we thank Vodafone Healthline for that.
So that mom can be able to open the door.
This is it.
Please open the door.
Here's my little brother doing something special. He's setting the camera up with another bright idea.
Let's just open the door.
Yay!
Mom, I got this.
Afedie, usu betumi nya kwenya sronko a ye nije ye power Vodafone so. Ye di data bundles a eni seso Ghana ha brel. Ye ma da ye so, ye ni da so nyina bem. Enti beka ye ho, nya data mo ani je power bebre.
Vodafone, further together.
Hello, today in This Week in Medicine, we throw some light on conjoined twins. Have you ever wondered why they are called Siamese twins? I'll tell you. Siamese generally means someone who comes from Thailand or a native of Thailand, just like we have Ghanaians, Nigerians, or South Africans. In the 19th century, there was a freak show where paying customers queued up to gawk at Egg and Chang, adult conjoined twins who came from Thailand. So, hence the name. Over the years, the term Siamese twins has been integrated into our diction without ill meaning. But I believe that from today, you would resolve to rather say conjoined than Siamese twins. Conjoined twins are a very rare phenomenon, with a higher incidence in Africa and Asia. The first recorded successful separation of conjoined twins, according to the Guinness World Records, was carried out by Swiss surgeon Johannes Fascio in Basel, Switzerland, between 2nd November and 3rd December 1689, a long time ago. In the literature, however, there is evidence of separating conjoined twins in the Byzantine Empire in the 900s, even before we got to 1000. We're in 2000 now. One of the conjoined twins in this case had already died, so the doctors attempted to separate the dead twin from the surviving twin. The result of this, however, was partially successful, since the remaining twin survived but for only 3 days after separation. Now, we switch our attention to our motherland, Ghana. In 1999, a breakthrough surgery was performed in the Korle-Bu Teaching Hospital, where conjoined twins were separated. They were joined from the lower portion of their chest and the abdomen, and they shared a common liver and other vital organs. You know, the good thing is 22 years after, the twins met with their lead surgeon, Dr. Hodasi, and one of the surgeons of the operating team, Dr. Ampedu Mensah, to express their gratitude. It was an emotional reunion of the twins, together with their parents, as they expressed their gratitude to the surgeons for performing such a feat to ensure that they were alive today and living a normal life, despite the scarce resources available to them. In the Maya Kanye Day, the boom wona identify, but no wabum, ebia wansa, and ebia wo yefun, and ebia woti, baby a boom, na abatu no odeba, at the pot no odeba ye nim, but my nim ni there. Sa interphone wonyina, I wanna wofi nkusua krum, ebo honoma, na won honam baby wafam nti won tim ntum tetu ye. Obandama, odewo your operation na wotum wo eden, wo ma wo ebien what to one tim. Na Ghana 1999, yeah doctors nbi wotum ye dama surgery. Ma ahontafu na wo won surgery still what I send there. On cherry bia wo share hon, ma oda doctors nurse. This is all we have for this week in medicine.
Welcome to Jewels in the Kitchen, and now you're back at Ginger. Ginger, you're tired to be Ghana, dear. You create you cocoa and a cran in the moon. Bonim so any word. Book I saw where it's not a chairman last time. Anti-inflammatory, antioxidant. Ginger will be. You understand what it means now, so mean to us today. But ginger also bad with digestion. And so be a not saying go start shishing and we are not drinking the bono. We are a cake do tea because maybe now we'll say pick it and get here and we'll miss stomach no and be a so fine. I think it also bad be an that nausea, vomiting, what have to say and manner. So many people no more for fear more and I so many almost phenomenal. Yes. So ginger helps with that as well. Ginger actually also helps people with osteoarthritis because it's anti-inflammatory and it soothes pain. It soothes a lot of pain. So you want to take ginger for that. It can help with weight loss. You've seen a lot in the weight loss mixtures that's going on social media. It's true. There are certain things in ginger that can help with weight loss. But because ginger may be going to know, but I can't say ginger so your idea with what they call dyslipidemia. And go on one cholesterol, and answer the triglycerides, cholesterol. No more be multi fat no more than and put you into the global hospital near BP was showing animal and what BP nankasa. But Australia cause problem, no. etimi bo ama ne balance na mmom na kekaduro ne ye no na ehso di ne bebre so na say when yinsen a na say you're expecting it can too much of it can cause miscarriage. You want to be careful about that. Almost draw for clotting. Moja clotting, man, you want to be careful taking too much ginger because it can reverse the effect of the medication. And so that's all I have for you today on Jewels in the Kitchen. Docs. I use my famous words. As you know,
anti-inflammatory.
Anti-inflammatory. Antioxidants. Yes. Yes. Mrs. Professor. But what were your highlights for this episode?
I think, what was it KK said about machoism? No?
Yeah.
No, but I think we should be considerate. This encounter should be a give and take.
Okay.
It should not be pleasure at the expense of somebody else. And I think that for me, that would be my advice.
Okay.
For our little boy, he's had this abdominal swelling for a while. I just want to encourage everybody here that if you have anything you're not sure about, as much as possible, make contact with the right health service. You see, so that whatever is there, whatever needs to be done will be told you early. Most at times, we may not be aware, but before they come. Sometimes it comes a little too late. Okay, and I'm also happy that they said that men can also do the kangaroo mother care. Just that if you are too hairy like some people, I know some guy. Hey, I don't know, but let's make sure that
genetics.
Yes, I'm happy that. So if you have a preterm, male, female, take turns, and then let's all help to make the baby's life more pleasant.
Yes. So in view of that, I'll add to it that. It was made clear to us that because of that, the international community is even changing the name from kangaroo mother care to kangaroo care.
Great.
So that there'll be no discrepancies over there.
So they don't say that I am something when I do it.
You are not something.
There's a lot hidden in that change, but we'll leave it for now.
For now. And don't forget that if you have any medical issues you don't understand, you can always call 255. And qualified doctors actually, medical practitioners will be available to answer all your calls. It's been a pleasure once again. I've enjoyed myself, learned a lot. Always. See you next week.
Bye.
Vodafone, further together.